Hi, it's Dr. Patricia Coughlin, and I just wanted to clarify the purpose of this channel. I started this to really inspire and support psychotherapists who are dedicated to doing work of depth and significance and really want to get better at what they do. And for most of the time this channel has been up and running, the comments and questions I've gotten have been from practitioners. But I'd say in the last 3 or 4 months, probably 90% of the comments are coming from, everyday folks, and very often from patients who are in therapies that are apparently stalled or in which there are some intractable difficulties. And folks are writing to me and asking me about that. And that's, of course, not the purpose of the channel. And it's also a position that I really am not willing to assume. I can't tell you what's going on in your own therapy. All I can say is that whatever it is you're thinking and feeling about the process or towards your therapist, you need to reveal that openly and honestly. And any good therapist is going to welcome that and help you work with it. And if they're not open to feedback and to discussing the process, then it's probably not going to be workable. But in any case, rather than going to third parties and asking, again, I encourage you to open up and be direct with your therapist. And please remember, they work for you. You're the one hiring them and paying them. So very often, and again, what I'm getting from a lot of these messages is that people are turning this around as if the therapist is the one who's in charge and who has the power. But again, that's really your power. So don't give that away. So to get back to the purpose of this channel, which is helping therapists learn how to get better at what they're doing, I wanted to let you know about an interview I did with a psychologist from Denmark who's got her own podcast. And in this podcast, we're talking about the difficulties, the challenges in learning ISTDP in particular. This is a very complex and demanding treatment. It's not for everybody. It's not for every therapist, and it's not for every patient. We know from research that there are 20% of patients who are relatively healthy. They can make use of everything and anything. ISTDP, intensive short-term dynamic psychotherapy, was developed in particular to address and treat patients who have proven resistant to other forms of therapy. And that's where this method really begins to stand out, with cases like treatment-resistant depression, pain syndromes, unexplained medical symptoms, personality disorders. So again, for those therapists who are motivated to be able to help patients who typically don't get help because of their defenses and the ways in which that creates resistance, and you want to be able to get through to these people, then learning ISTDP can really greatly expand the number of patients that you can treat effectively. It's going to increase your morale, and it's going to make your work more effective. So I'm going to leave a link to this conversation that I had with Matilda about, again, the challenges, but also the opportunities and the tremendous capacity for growth in the training process with ISTDP. So if you're interested, give that a listen. Thanks. Bye-bye.